At you? Just look at.
Yeah. Just look at me. So, what did you teach today, Laura?
Today I taught, had an impromptu lesson for nursing students that are about halfway through their training. From what they tell me, it takes 5 to 6 years to become a nurse here in Ecuador. So these are at the end of the third year, and they have never worked in surgery, so this is their surgery rotation, and they have never worked with children in surgery. So today I gave them an impromptu lecture on cleft lip and palate and the surgical repair of them, and primarily the post-operative care. So, because that's what we would be concentrating on here in the recovery room today. We had 2, 3, I think we had 4 to 5 cleft lip and palates today. So we had a good experience with being able to teach them. Unfortunately, out of the 8 students that were there, 3 were in the recovery room, the other 3 were in the surgical suites observing, and the other 2, I'm not sure where they were. I think they were on the surgical floor. And every day they rotate, so I will not have the same students with me tomorrow. So.
Okay. Do you think that what you taught them, that it went over well, or do you think it was stuff they had already learned elsewhere?
They said they didn't know anything about cleft lip and palates, although many of them have said, I think all of them said they've seen kids with cleft lip and palates or people with cleft lip and palates here in Ecuador, but they did not know anything about how it was repaired. So yeah, I think it helped them because I think they were able to understand a little bit of the anatomy. They may not quite understand the surgical repair, although they had a little bit of idea. After surgery, I showed them how the palate was closed, and they saw the kids beforehand, so I think they were able to get a little bit of an idea. But it would be best for you to ask them, especially the 2 that I worked with here, whether it was a benefit or not.
Okay. I'll do that. Thanks, Laura.
Sure.